itself, or it could be in the apparatus of the ear here, meaning a conductive type of hearing loss. So for example, you have a hearing loss here on the left side. Okay, you test first using the Weber test to check if the vibration sound travels to both ears, which is normal. So if it travels to both ears, it means the Weber is midline. That's the result, if it's a normal one. So the Cranial test asks you to compare first, putting the end of the tuning fork on the bone here, and wait till the patient says they can no longer hear it using their bone conduction, and bring it over here in front of the ear canal to see if they can hear it. That's the Cranial test. So if you have a hearing loss on the left, you now depend on the results of the Cranial test and the Weber test. Now, if the Weber test, so you knew that the bad ear was here on the left side. If the Weber test lateralized to the bad ear, this is a sign that the problem is probably in the conduction of the sound waves through the ear canal, or a conductive type of hearing loss. You confirm this with the Cranial test, because by the time the sound disappeared, the tuning fork was placed here on the bone, it is no longer heard here at the ear canal, meaning bone conduction is greater than air conduction, when usually air conduction should be longer than bone conduction. In this case, with the findings on the Weber test, this is a conductive type of hearing loss. Okay, so the problem is not involving the 8th cranial nerve over here. So Weber, the sound lateralizes to the side of the bad ear, and on Cranial test, the bone conduction is better or longer than air conduction, which is not supposed to be that way. So this is conductive hearing loss. But in the case that the Weber test lateralizes to the good ear and not the bad ear, and the Cranial test, both air and bone conduction are not heard or barely heard, this is a sign that your hearing loss is due to an 8th cranial nerve problem and not due to the inner apparatus of the ear or the canal. So this is what we call a sensory nerve type of hearing loss, sensory neural hearing loss.